Yeah, thank you, ladies and gentlemen. My name is Victor Obasuyi. So today I'm going to be talking about the difference between cataract and pterygium. Patients tend to use these words interchangeably. I've had my cataract removed 5 times and it still keeps growing back. I've had my pterygium removed. As a practitioner, when you look into the eyes, you find, although the patient is claiming that they had a cataract removed, you find the natural lens still in the eye. So at that point, at least you can tell that what they're talking about is pterygium. As a practitioner, it's easy to tell the difference, or to tell when the patient has had pterygium and they think is cataract, or they've had cataract surgery done and they think is pterygium. You can tell by looking at when you dilate the pupil to look at it, to look inside the eyes. But the drawback to it is other patients that they tell, and they get scared now of having cataract surgery done. I had a case in point is I had a patient recently. 3 different times I've referred the patient to the ophthalmologist, and on each of the occasions I set up the referral. Then when it's time, the patient calls the surgeon's office to cancel the appointment or reschedule it. So this kept going on until recently when he came in. I found out, okay, now the vision is below the driving requirement, like way below the driving requirement. So which meant I had to pull his driver's license, because that's the law, for his own safety and for the safety of other road users. So at this point, patient wasn't too happy when I said I have to pull his driver's license. So he had to open up to me that, look, doc, he's really scared of having this surgery done because his neighbor has had cataract surgery done more than 5 times, and it keeps growing back. Patient keeps having to go back to redo the surgery. So I was taken a little bit aback, knowing fully well that cataract surgery, once you've taken out the cataract lens and replaced it with intraocular implant, or intraocular lens as the case may be, it's seldom for you to have the surgery done 4 or 5 times and the cataract keeps coming back. So I was able to put 2 and 2 together. I said, you know what? I think this person is confusing this terminology with pterygium. So I told my patient, I said, you know what you're going to do for me? I want you to go home and ask your neighbor, confirm again. So I wrote pterygium down and I wrote cataract down. I said, ask your neighbor which one he did. So he said, no, it's cataract. That the neighbor says he did cataract surgery. So I said, no, take this to ask the neighbor and let the neighbor confirm with the doctor, or the doctor that did the surgery, let the neighbor confirm. Lo and behold, it came back that pterygium surgery is pterygium that he had, not cataract. My poor patient has been canceling his appointment because he's afraid that he might do cataract surgery and have to do it like 4 or 5 times and it will still keep growing back. And this doesn't just this does not just apply to my own patient here. Sometimes when I talk to my own folks back home, it's the same thing. Oh, doctor, I've had my cataract removed. I'm thinking having cataract removed at 30 is it's not unusual, but it's not the norm. It's a very rare case. So, and most times when I probe into it, it's all usually the same thing. Especially when they keep saying, oh, I've done it 3 or 4 times. It's almost end up that what they're doing is pterygium, not cataract. So these 2 conditions are very different. Pterygium is a problem of the conjunctiva, usually from exposure to UV, and that's why it's UV rays from the sun. And that's why it's very common people from the tropics. Because most times back, people from the tropics spend a lot of time outdoors. and they're outdoors, eyes are unprotected from the UV rays from the sun. A lot of them don't wear sunglasses, UV, or even if they wear, they don't wear UV protection sunglasses. So over time, from exposure to this UV from the sun, I think 1 in 5 eventually develop pterygium. That's how bad it is. People from the tropics, 1 in 5 almost always have pterygium. And the usual complaint is sometimes I feel like there's gravel in my eyes. Or you find a red spot. People are looking at you and wondering like, why your eye is always red? It's just a red spot between the nose, between the inner canthus and the limbus, and the inner limbus. So which is between the nose and on the white part, between the black part, which is the iris, and the nose. Usually you find it there. So that's pterygium for you. Pterygium usually does not affect your vision as much, unless it's really matured, in which case it starts to induce a little bit of astigmatism because it's altering the shape of the cornea. Unlike cataract will make your vision blurry. That's the chief complaint in cataract, blurry vision. And that's because the lens in the eye starts to become cloudy. So it's like you're driving and looking through a dirty windshield. That's cataract. Cataract is something that everybody gets with time. It comes with age. It's like gray hair. You cannot avoid it. Pterygium you may or may not get. But cataract, almost everyone gets cataract as you get older. It's like gray hair. Every animal gets it. That's cataract for you. Where pterygium, the patient complains of redness, in cataract you don't have red eyes. Cataract does not cause red eyes. Patient will complain of, sometimes I feel like there's gravel in my eye, in pterygium. Cataract, you don't have that. Anybody can look at you and note that you have pterygium. But cataract is a problem of the lens inside the eye, so you need a microscope to see it, unless it's very, very matured. In which case it's called a dense cataract, or mature, hypermature cataract, as the case may be. So they are different. When you have pterygium, anytime it flares up, and usually it will flare up if there's heat, wind, or dust. So a lot of people, when they're driving, they leave the windows open. So the wind hits the eye if you don't have anything covering the eyes. Dust will hit the eye. The heat will also affect the eyes. So most times if you're driving and you have pterygium, the best thing to do is the vents, turn them aside. Don't let them hit the eye directly. If you wear a pair of glasses, put them on. That way the vent, the air from the vent is not hitting the eye directly. So that way you don't aggravate the pterygium. If you don't aggravate pterygium, you won't have those complaints of my eye feel like there's gravel in it, or when the eye is usually very red. Sometimes it's watery. Cataract, on the other hand, doesn't really bother you much, apart from the fact that your vision is blurry. So there are two different terminologies. An inflamed cataract, you can throw in teardrops in it to calm it down. Or if it's really bad, then you can use a steroid momentarily just to calm it down. Cataract, on the other hand, a steroid will make it worse. Putting teardrops in the eyes for cataract will not do it. It does not solve the problem in any way. But if you have pterygium and you put teardrops, it calms the eyes down. So there are two different situations that one should definitely understand. So what I'm going to do, I'll put the pictures or both. So that way you can look at the picture and know, okay, this is pterygium, this is cataract. So next time somebody's telling you, look, I've had my pterygium done 5 times, you know, okay, that's pterygium. Then when they say I've had my cataract removed 5 times, question it more. Because it's likely not true. It's not unusual for cataract to grow back. That's the implant, to develop a secondary cataract. But it might take usually 5 to 10 years. And all they do is just polish it. So it's not having to scrape like pterygium. Pterygium is the one that tends to grow back from time to time, where the patient will tell you, I've done it 4 or 5 times. But with the use of mitomycin drop these days, even that also reduces the rate at which pterygium grows back. So thank you, ladies and gentlemen. I think this should explain the difference between both. Knowledge is never wasted. So whatever you've learned from this, share the video with others, so that way we're all more aware. Thank you, ladies and gentlemen. Again, it's Dr. Victor Obasuyi. I appreciate those that have subscribed. If you've not subscribed yet, hit the red button. Subscribe. Help us let the channel grow. Thank you, ladies and gentlemen. Victor Obasuyi.